And so I think nurses traditionally think of nursing roles at the bedside. And so
Right.
one of the things that I think nurses need for the future is to become more dexterous in health policy, into bringing the voice of others to the forefront at the community level and with the politicians, and advocating for resources.
So tell me some of the steps that we can take today to be able to do that. What are just common sense next step? Let's do it.
Here's a real basic, right? This is a real basic. I think if we were to go around and poll nurses and ask how many of them are members of their professional organizations.
Okay.
Professional organizations for nurses advocate for issues that are important to nursing, and they don't often have huge budgets. So one of the first things I would say is that they should become a member of their professional organization. There's a difference between a job and a discipline. And to me, as I've talked to nurses throughout this pandemic, nurses who've been afraid to go in, right?
Right.
I've said never has that intersection of nursing with our covenant with society been more apparent than it is today, where you're asking the nurse to put her own needs on the back burner to go in and save the lives of patients. Right? And so I think one of the most basic things is advocating that nurses become members of their professional organizations, that we shift the impression of nurses as angels. Nurses, lots of people are angels, and nurses are certainly doing, I say God's work, right?
Right.
But nurses are highly skilled, intelligent, capable human beings who have extensive education and training that prepares them for their roles. And they should be viewed as such, and their contributions, therefore, to the voice of healthcare systems,
Right.
and to the overarching healthcare agenda of our country should be valued and included. And nurses need to learn to get their voices inserted in those discussions. So you become a member of your professional organization, because your responsibility and your contract extends beyond your 3 o'clock shift.
Right.
It's like, so another thing you can do is vote in a way that aligns with a humanistic agenda, one that supports that. So you don't have to go out and go donate, a bunch of money. You don't have to go volunteer 20 hours on the street, but there are small things that you can start to do that are in alignment with your perception of your role as a member of a discipline rather than a job. That there is a difference between those two things, right? And at the crux of it, we're holding humanity in our hand. And so it makes it really important that we're advancing the voice of the nurse, right?
Exactly.